Reminisce back, if you will, to Ed Foundation's 101. Oh, you're thinking about that hairstyle and those clothes that you thought were so cool. While you blush with embarrassment at this moment, think back to Ed Foundation's 101 and Horace Mann. Who? Maybe it's time to go back to Ed Foundation's 101. He was the 19th century education leader who, in the early 1830s, then a young representative in the Massachusetts legislature, led a commission in their task to create a state lunatic hospital to house the mentally ill. Many of these individuals had been incarcerated, often treated in a vile and inhumane manner by county sheriffs. Mann was insistent that the facility include up to date air ventilation and plumbing systems, along with quality food service. He was adamant in his views that a healthy environment and one that had compassionate treatment would alleviate, if not cure, many of the patient's physical and psychological afflictions. To paraphrase Dr. Mann, we need to respond to the most difficult students like physicians who find challenge in difficult cases. It is illogical to become angry and punish errant youth, like physicians attacking a limb he or she is treating. Those thoughts are consistent with the practices based on the circle of courage. Investigate the condition of concern, identify the areas of strength and weakness. Based upon that assessment, devise and implement an effective and compassionate plan for recovery. Knowledgeable and effective behavioral physicians know that belonging is fostered via opportunities to form trusting and supportive attachments to others, that mastery is developed through opportunities to solve problems and strive for goal attainment. Independence is promoted when given chances to take responsibility, be self directed. Generosity is nurtured through opportunities to help, show concern, be kind, and show selflessness. Humans are neurologically hardwired to connect, solve problems, and restore and maintain harmony within their system. Kind of the behavioral version of astronomy's chaos theory. Our at risk kids didn't get the guidance in appropriately meeting their psychosocial needs. So when we're assessing a student's circle, finding out how true is the wheel and which parts of the wheel need to be trued, our first question is, where is the circle broken, bent, or distorted? Which of the fundamental needs are unmet? Remembering that while we're assessing the students, they've got an eye on us. They're assessing us. They're wondering, are we worthy of their trust and confidence? They're putting us under their own microscope. Although sometimes I felt like I was underneath the magnifying glass. I was the ant underneath the magnifying glass that concentrated the rays of the sun. We want to move forward together. And this is done through what's known as a developmental audit. It utilizes strategies for conducting strength-based assessments, not just finding out where are the deficiencies, but where are the strengths that the kid brings to the table. The developmental audit draws on bioecological research and the Circle of Courage resilience model for its content, for its format. In this developmental audit, a caring and competent adult works with the youth to explore problems, strengths, and what are the goals of that youngster's present behavior. Jointly with the youngster, we produce a positive growth plan. The developmental audit and strength-based assessment, as it's known, views the young person as the primary source of data. We certainly engage in the typical assessment procedures during this period of time, but in the developmental audit, we're scanning the student's ecology, his or her life, and all aspects of it via the available records that we have and resources that we can tap into. Get the perspectives of other significant persons in this young person's life. We identify the sources of stress, the negative influences, the sources of support, and the positive influences, significant life events for this child. We also investigate the student's private logic, to use Alfred Adler's term. We investigate how he or she perceives events, people, places, and what is the reasoning behind his or her actions. We identify how the youth copes with challenges and stress in both resilient ways and self-defeating actions. And we determine, how did this young person come to this point in his or her life? We then determine which goals to set and specific restorative practices to prescribe that will foster personal growth and responsibility. Then it's time to sit down with the youngster. And our intervention statement would go something along this line. You know, you've been making some big blunders due to ignorance, poor judgment, lack of self-discipline. To be successful and happy in life, it's important to make better choices. And you've got that potential. I see it in you when, and we identify some positive actions at this point. I'm here to help you become all that you can be. Now, I know that a lot of people have let you down, and we don't know each other well enough yet for you to really trust me. That time will come. I plan on sticking with you. If you think that I'm letting you down at any point, you tell me so. We'll work to clear things up between us. Anyway, let's get to work together now on a plan that'll get you to a better place. Now we talk about the information we've gathered. We talk about the plan that we think might work, but we take the student's input, and again, we're always working with the student. We've reached the end of the fourth and final podcast regarding the Circle of Courage. If you wish to continue building your knowledge and skills regarding this model, revisit behavioradvisor.com, locating the PowerPoint slideshow titled Questions and Activities for the Circle of Courage. Additionally, we'll have some information coming up at the end of this podcast, other resources where you can gather further information. Oh, final item to consider. Are you a significant adult who is making the optimal impact on a youngster's life? I trust if you've listened this far that that is indeed the case.